Welcome to the SIBO SOS Podcast. I'm Shivan Sarna, your host. Today, we're going to talk about a very personal topic, and it is hemorrhoids. That's right, I said it. Even as talk of digestive issues has become way more mainstream, hemorrhoids remain something people just don't want to talk about. But that's a really big problem because they can be very painful to say the least and devastating if you have them, dangerous even. And solutions do exist, as well as some preventive measures you can do. So I'm very excited to have naturopathic physician Dr. Crane Holmes joining me for this discussion on hemorrhoids. Dr. Crane Holmes and I are going to be talking about hemorrhoids. Yikes! He has a busy practice in Portland, Oregon, and has worked with some of the other superstars of this project. And so I'm so glad to introduce him to you. Thanks, Dr. Holmes, for talking to us about a very important topic that most people don't enjoy chatting about.
Right, thank you.
Let's go there. Okay? So if you have a hemorrhoid, it's painful. It doesn't always bleed, right? Mm-hmm. What exactly is a hemorrhoid?
Right, so hemorrhoids affect about 50% of people over the age of 50, and about 30% of people have some sort of hemorrhoid or symptomatic hemorrhoid. So a hemorrhoid essentially is a varicosity of the hemorrhoidal veins. So there's two different types of hemorrhoids. There's internal hemorrhoids, which are part of the superior hemorrhoidal vein. There's external hemorrhoids. And the kind of big difference there is that the internal hemorrhoids tend to be painless, and the external hemorrhoids tend to be more painful. The reason for that is they're covered in two different types of cells. So the internal ones have columnar cells, and the external ones have squamous cells, and because of that and how they're innervated, some people can have painful and some people can have painless hemorrhoids.
Innervated meaning because of the way the nerves go to it?
Yep, the way the nerves go to it.
Okay.
Correct.
So I had a friend who had a colonoscopy, and on the little report it said internal hemorrhoid. Yep. She was like, what? And she had no idea. And so is it okay to have an internal hemorrhoid? Is it something we should monitor, be aware of, talk to our GI doctor about it for the next time we get a colonoscopy?
Mm-hmm. Yeah, like I said, so most people over the age of 50, over half have some sort of hemorrhoid.
All right.
They can grade hemorrhoids, so there's 4 different grades of hemorrhoids. So for a lot of people, they just have these mild grade 1, grade 2 hemorrhoids. They don't notice them, they don't bleed, they don't cause any pain. And for those people, they usually, we just think about dietary changes or some basic lifestyle things that we could do to help manage those for those people.
Meaning more fiber or less fiber?
Yeah, more fiber.
Okay.
Definitely.
Okay.
And things that tend to cause hemorrhoid in people are anything that increases our abdominal pressure. So straining during bowel movements or uncontrolled blood pressure, things along those lines.
Never heard of that before.
Yeah.
Bloating?
Bloating could be an issue, but it doesn't necessarily increase the pressure enough to cause the hemorrhoid to
flare.
Form, yeah.
Okay.
The way that I talk to my patients about hemorrhoids is I kind of say it's like a balloon, right?
Yeah.
So you take a balloon, the first time you blow it up, it's kind of stiff, it's hard to blow up, but as you continue to blow it up and blow it up and blow it up, it can kind of get easier and easier to form a hemorrhoid. For a lot of people, if they're not straining, they may get small ones because it's just blowing up a little bit. But if you're getting strainings or increasing pressure, those hemorrhoids can continue to grow and continue to stretch, and you can get recurrent hemorrhoids.
Okay, let's talk about the kind that bleed,
Mm-hmm.
because that is scary. Seeing blood in the toilet, red
Definitely.
blood or black blood, meaning that you've already digested it. Obviously, it's a horror. It's a horror.
Definitely.
It's a horror. So, do you have any suggestions about what we should be thinking about if we have a hemorrhoid that is bleeding, and then any thoughts on prevention and treatment?
Definitely. So you're 100% right. So when people have blood in their stool, the first thing that I would think about, especially as a doctor, is come see someone like myself, right?
Mm-hmm.
Like, it is scary, and sometimes the easiest thing that we could do is just give people peace of mind that maybe it is something just like a hemorrhoid, and it's not something worse. So that usually gives people peace of mind right then. So coming to someone's office like myself, we can take a look and say, yep, for sure, that's what you have is hemorrhoids. And then, like you mentioned, we're thinking about, okay, A, how do we prevent it from bleeding if it already is bleeding? And B, how do we get it to kind of go away? So there are some things that we can do topically for it, both natural and pharmaceutical. So a lot of those things will decrease pain and kind of help tonify the vein. So help make sure that it's staying more stable, more strong, and holding all that blood kind of back. So we definitely have some options like that. And the other thing to do is to really prevent straining in bowel movements in general. So most commonly we see patients that are constipated developing hemorrhoids. So something that I really commonly use is something like magnesium. So people who can find that right dose of magnesium to help have easy bowel movements, they're not straining, using a squatty potty or something to bring their feet up. So again, that we're decreasing the amount of pressure that they have to do, and then also exhaling if you have to strain during a bowel movement. So instead of holding your breath and bearing down really hard, having a nice breath out while you're having a bowel movement too.
What are some of the topical things that you can do?
So topical, really common, most people have heard of is Preparation H.
Oh yeah.
Preparation H is something that's widely available. Interestingly, so it contains things like phenylephrine, which can help with the pain. It contains a steroid cream and witch hazel. So that's kind of what we think about when it comes to Preparation H. And the witch hazel is that thing that I said that'll actually help tonify the veins. And then naturally we have things like stone root, witch hazel again, something called yarrow, cinnamon, and some of these can be either taken in a capsule orally, or they do actually make a cream that you can use on your rectum as well.
Stone root? I've never heard of that.
Yeah, stone root. It's
an herb?
It's an herb that really just helps tonify the vessels.
Oh, that's cool. Okay. Chinese medicine.
Yep.
Green box. I see it. It's like a soldier's pill. Do you know
Okay.
what I'm talking about?
I'm not familiar with that one.
It's this pill that they used in war in China if somebody was bleeding on the field to help with fixing the bleeding. And a friend of mine who goes to an acupuncturist, she said she took these pills for her hemorrhoid, and then I was having some surgery, and my acupuncturist gave me the same pills because she wanted to make sure that I would heal up quickly from any bleeding.
Right.
So I will put a link about the name of those pills.
Right.
Note to self.
Right.
Yeah.
That's great.
Yeah.
You're right.
They're these little, it's like a bubble pack, sorry. But we'll give you the information because it's cool. It's apparently like super fast.
Well, that's interesting because you mentioned after surgery, because for some people, depending on how severe their hemorrhoids are, surgical removal is one of the options.
Okay.
And they actually find, so they call them phlebibotanicals. So
Flebo. So my surgery was for something else. God, please don't make me have to have surgery for hemorrhoids. That sounds horrible. And yet, I'm sure it's a relief for some people.
Right. Yeah.
Phlebibotanicals,
so helping with the vein and the vasculature.
Okay.
And they actually found in a large study in 2012 that the phlebibotanicals that help with the vein actually do help with healing after post-hemorrhoidal removal, and will help with people that do have hemorrhoids decrease bleeding and decrease overall symptoms, but it won't really decrease the pain. So people that have painful hemorrhoids, it's worth a shot, but it may not work, and it may not work, and it may take removal or other options to get rid of it.
Let's talk about some of those other treatments because I know there's surgical, and then there's also some other alternatives that not a lot of people are doing around the country, but I think you're familiar with those.
Right. Yeah. So definitely one of the more common things to try is oral. So that's usually the first place that people start. And then
when you say oral, do you mean like a pill and a pharmaceutical?
Yeah, sorry, yeah. So so pharmaceutical oral pills or topical, like something like Preparation H, to see if that alone can help decrease the size. And then also, like we mentioned, fiber intake and things to help produce normal bowel movements and help all those pieces at the same time. So as far as surgical goes, so there are colorectal surgeons that do treat hemorrhoids and treat colorectal health. So one of the more common things that they will do is something called a band ligation. So they put basically a rubber band around the hemorrhoid and see if they could just decrease blood supply to that area and see if it'll go away. Other times they'll go and actually cut them open and sew them closed. And the problem with that is for some people who already have issues with bleeding, either issues with prolonged bleeding or bruising or easy trauma, I guess, to the vasculature, they can have a lot more issues coming out after those surgeries. So something that we'll try to do is naturopath, or something that I've shadowed with and practice here in Portland, is something called the Keesey technique, or electrosurgery of the hemorrhoids.
How do you spell Keesey?
It's Keesey.
Okay. And what is that? What's involved there?
So essentially the idea there is it's we call it a monopolar electrocautery. So we're sending milliamps of direct current into the hemorrhoidal tissue. We only treat the internal hemorrhoids this way because, again, they are painless. where the external hemorrhoids are painful. So for people that have external hemorrhoids, they'd have to think about other options. But for internal hemorrhoids, which tend to be the more common type, it's a great treatment. So what we do is we essentially insert the electrode device into the hemorrhoid while someone is just laying there on the table, and we run some electrical current through there. It will cauterize a little bit of the tissue, so since we're thinking about the veins needing a little bit of support that way. But the biggest part of it is it actually brings our immune system to those cells itself. So kind of the forgotten area of the body in some ways, where we have this boggy, saggy, maybe inflamed tissue that we're then sending an electrical spark to that tells the body, hey, we need to bring some guys in here to clean up the area and gobble up some of this extra tissue and see if we can shrink the hemorrhoid down itself.
That's cool.
Yeah, it's super cool.
It's like microneedling for the face, kind of.
Yep.
That's what it reminds me of.
Yep.
Would the patient who has Ehlers-Danlos, do you think that they might be more prone to something like this because of the laxity?
Definitely. Ehlers-Danlos syndrome patients I see commonly with hemorrhoids and also fissures. So fissures are also a problem with rectal health and are usually actually the most common cause of rectal bleeding.
What is it? What is a fissure?
So a fissure is basically a crack that forms in the skin around the anus. The most common place that a fissure actually forms is the posterior part of the rectum, and then the anterior part. And the reason why they're actually really interesting too is because if you ever have fissures on the lateral side of the rectum, then we're thinking of issues like Crohn's disease or other autoimmune conditions. So again, patients with rectal bleeding, it's always good to have it looked at because there's a couple different things that can cause issues there. And if we recognize that, oh my gosh, like this fissure is more lateral, it's not in the normal spot, then we want to make sure we're really doing our due diligence to think about other issues other than just like, oh, it's just a little crack in the skin.
Okay. And does it come from dryness?
So normally it also comes from constipation.
Okay.
Constipation, some people for loose stool too, and then they're also common in pregnancy, post-delivery. So that's where we'll see them too. Yeah.
So we're going to just continue to go here because we're in the conversation. But like wipe front to back. Do you have any suggestions for people who are suffering with this, like using witch hazel frequently?
For the hemorrhoids?
Yeah, and just for like life. Do you have any advice for people for life? Because no one is talking about this. Let's face
advice,
it.
Yeah.
Yeah, life advice for, personal hygiene.
Right. Yeah. First, always look both ways before crossing the street. That's always good life advice.
Okay.
And I think the biggest thing really is to try to prevent constipation or prevent straining. I mean, I think prevention model is one of the better ways to do it. For some people, like preparation H can be great because it's something that can be discreet. You can take it with you, and if you're noticing worsening problems, you can do that. Another thing that can help a lot of people is a sitz bath. So sitz bath is a form of hydrotherapy where you actually just sit in warm water. And a lot of research out there shows that the sitz bath will actually relax the internal sphincter of the rectum, which they think has some correlation with why people may get recurrent hemorrhoids.
Okay, let me ask you a question here.
Yeah.
What do you put in that? Is it sitz bath like sits yourself on down? S-I-T-S?
S-I-T-Z.
S-I-T-Z, okay. Yeah. Named after the famous GI doctor Ben Sitz. That's not true. I don't know who that is, but that's a little Google moment you can have right there if you care. But do you put anything in that water?
For most people, they just warm water is totally okay, right? For some people, depending on what it is, I mean, I've heard some horror, I don't want to call them horror stories necessarily, but some people putting essential oils and other things into the water, and depending on what it is, causing more burning or more pain. So for most people, I recommend just trying just hot water and just seeing how it could relax the muscles and relax the tissues.
Do not put peppermint in that water.
Don't put peppermint in the water.
There's something I just saw in the market. It's called a Shakti spa. Do you know what this is?
No.
It's like for vaginal steam baths.
Okay.
And it's like this little, it's like a little mushroom that you would sit on, and on the inside there's like literally like a facial steamer. It's just a steamer, and then you can put different herbs in it, and then you sit yourself on down there. And one of the people who were telling me about that said that one of the women experienced like a total relief in constipation from the activation of that area of the body.
Okay.
I thought that was really interesting.
Yeah, I could totally see that.
Yeah. And then the other thing I was going to ask you about was magnesium. What kind do you like?
Right. So I always find it's very patient dependent. So I usually start with a blend for a lot of people. So magnesium citrate or magnesium oxide or magnesium malate. Whatever kind of works for people. Sometimes I really like to, a lot of patients after they've come to see me have tried a couple different things, magnesium usually being one of them. So I usually just have people start with whatever they already have at home and see if it works. Sometimes, the one thing that I notice commonly is people try taking in divided doses. So take some in the morning and take some at night, and they're like, didn't really help with my constipation. But I find that people could take it all at one dose at once at night, usually right around bedtime. It usually helps to be a little bit better to produce a bowel movement in the morning that's easy to pass with no straining. I love powdered magnesium because that way it's really easy to find the right dose that works for a person, and you don't have to worry about swallowing a bunch of pills.
Yeah, and there's Calm out there.
Yep, Calm's a great one.
A huge product. And what do you think about the topical magnesium creams?
Yeah. I haven't found those to work really well for bowel movements.
Yeah.
I did see, though, an interesting study out there about using topical magnesium to actually increase DHEA levels, one of our master hormones in the body that helps with different sex hormones and stress regulation. So could be interesting to try for that at least.
Yeah. What about, sorry, I have a lot of questions
here.
I
love questions.
A lot of questions for you. That's how this whole thing got started, all these questions I have. Foot reflexology.
Yeah.
I love foot reflexology. I was blessed to be introduced to it when I was 13 years old, and it's been such a tool for me. It puts me very quickly into a parasympathetic state. I know some people can't stand to have their feet touched, so
not for them.
Not for you, that's fine. But you can do motility things with it and all that kind of stuff. Have you found that to be true?
Yeah, I think that for people that enjoy touch and enjoy touch therapy, I think that foot massage or foot reflexology is a great option. Yeah, and even just for some people, just putting their feet even in a warming bath with a little bit of magnesium salts too could be really nice. One of the things that we talk about too is with a lot of patients is just even getting outside barefoot in general, and then just how nice it is really just to have your feet massaged and touching the ground and kind of just getting feedback can really help just calm people down and put them more into their body and help with bowel habits and things like that.
Little foresting, even if you don't live near a forest.
Exactly. Yeah. Some people I just tell if they have grass anywhere, just get a lawn chair and sit outside and drink your coffee outside. If that's your only outside time that you get all day, that's something.
That is something.
That's something.
Something in the right direction.
Right.
Thank you so much. We covered a lot of territory there. Really good to have you. Great to be with you today.
Thank you.
Thank you so much to Dr. Holmes for being willing to get down to the nitty-gritty on these important, if uncomfortable, topics. If you're interested in learning more about Dr. Holmes, be sure to check the show notes to find his website. Also, be sure to check out all the exclusive discounts we have for the SIBO SOS community, which you're now part of because you've been listening to this podcast. And thanks for that. See you next time.